Hi, I'm Dr. David Stoker, board-certified plastic surgeon in Los Angeles. And one of the questions I get often is, should a patient who wants breast augmentation choose a silicone implant or a saline implant? And I wanted to go over the pros and cons. What I'm holding here is actually a sizer. With the saline implant, it has a tube, a fill tube. The saline implants, which is basically salt water, the same substance we use for intravenous fluid during an operation, it fills an empty bag. We then remove this valve and it automatically seals on the inside. Saline implants used to be very common because silicone implants, although they were first done in the 1960s, at some point in the 1990s they were pulled off of the market because of alleged concerns about causing diseases. As it turns out, that evidence was debunked, and after much better data was collected, and simultaneously after more studies were done over the course of more than a decade, the FDA did approve the newest generation of silicone implants. And almost immediately, the silicone implants became much more popular than the saline implants. Why is that? Well, I'd say number one, the silicone gel implants feel a lot more natural than the saline implants. If you just look at this as I jiggle it, now this is also a cohesive or gummy bear implant, but when I jiggle it, it maintains its form. It basically feels like a human body part. The saline implant is more like a water balloon. It reverberates a little bit more. You see the waves and the ripples of it. It doesn't feel as natural. You may or may not notice the difference between these implants depending on a body type. If you're fairly heavy, and you have a lot of breast tissue already, you have a thick layer of breast covering the implant, you may not really notice the difference between a saline implant and a silicone gel implant. If you're closer to your ideal weight, or you have thinner breast tissue, you're going to notice a big difference in the feel between them. And silicone is going to be superior by almost everybody's assessment. The next thing is the complication rate. Saline implants do have a higher rupture rate overall. The valve can fail. There are many of these little ripple things here that any one of which can create a little fold flaw, a little pinprick. So there's a higher deflation rate, and that deflation rate goes up after about the 10-year mark substantially. Silicone implants, especially the latest generation ones that I use now, have a much lower rupture rate than the saline implants, so there are fewer problems with them. The one difficulty, though, about a silicone gel implant is if it ruptures, it is not obvious. A saline implant goes relatively flat over the course of a couple of days. With the silicone gel implants, they require some type of monitoring. You can't tell based on physical exam alone if a silicone gel implant is ruptured in most cases. MRI scans, ultrasounds, and less often mammograms are able to detect it. It is not necessary to replace a saline implant or a silicone implant just because a certain number of years has elapsed. However, after about the 10-year mark, because the rupture rate and failure rate does go up, many patients will start considering replacing the implants between the 10 and 20-year mark. Another important difference between these two implants is cost. The saline implants are about $1,000 less expensive than the silicone gel implants. And that is a reason enough for some people to choose a less expensive implant. In my particular practice, that is not often cited as a reason. Almost, I would say at least 95% of my patients end up choosing the silicone implant. I strongly prefer the silicone gel implants. I have fewer problems with them. The feel is vastly superior. Rippling is rarely an issue with these implants. I love the latest generation highly cohesive silicone gel implants from Sientra in particular. I would say that my patients have been very happy with the highly cohesive silicone gel implants, and most importantly, it looks naturally beautiful. So that's a summary of the difference between the silicone gel implants and the saline implants. I hope that helps you in your research for breast augmentation surgery. This is Dr. David Stoker, board-certified plastic surgeon in Los Angeles.